it's completely inadequate. It needs fundamental reform. So part of that is the Care Bill, which I think has been very widely welcomed. It's the biggest reform of social care law for about 60 years. And I think it fundamentally changes the approach that councils should take, focusing on someone's well-being, whether they're happy, whether they lead a good life. And that's what councils should be focusing on, as well as, of course, recognising that people have care needs. But I think if you build on their strengths and help them and their families cope in often very difficult circumstances, you start to get a more civilised system.
Our current social care system focuses on people and what they can't do rather than what they can do. And so we need to build a system for the future that's sustainable, that helps people to help themselves more than is currently the case.
As things stand, the current social care system really isn't fit for purpose because it stutters into life once the crisis occurs. Now, there are signs for hope. There are reasons to believe that the system can change and become one that is much more focused on prevention and early intervention. But one of the things we need to do better is actually understanding the significant change in our population that's occurring, the shift in the age profile of the whole of our society, and what the oldest old are actually like. There are professional judgments made about what the oldest old actually need, which all too often are completely out of kilter with the evidence when you look at the research.
I think the first thing we've got to stop doing is talking about social care in isolation and start thinking about health, housing and social care system. So I think none of us are as smart as all of us. That would be my message.
The current social care system is not adequate as it's currently configured to deal with an ageing population. But that doesn't necessarily mean that there isn't enough money in the system to handle it if we use the money differently. So what we need to do is to find much more collaborative ways of working across health and social care and housing and leisure to actually ensure that the whole is greater than the sum of the parts. Too much of the system at the moment isn't actually organised in a systematic way across the different functions and types of organisations across health, social care, housing, leisure. And we could get much better outcomes if we worked better together.